Hello, my name is Faith Alberti and I'm delighted to welcome you to tonight's event. I'm a historian of medicine, emotion and the body at the University of York, and I lead the AboutFace project. Funded by a UKRI Future Leaders Fellowship, this explores the emotional and cultural history of face transplants. Once the subject of horror films and things like Face Off, face transplants have become a medical reality, but they're still unusual. There's only been 47 face transplants around the world since 2005. Because it's a novel procedure, there's been little historical research into the ethics and outcomes of face transplants or their psychosocial effects. And that's where AboutFace comes in. We work with surgical teams, nurses, ethicists, and people living with visible facial difference to understand the meanings of facial reconstruction and transplantation at an emotional and social level. Tonight's event is part of the National Being Human Festival of the Humanities, which is taking place across the UK between the 12th and the 22nd of November. Being Human is the only national festival of the humanities. It's run by the School of Advanced Study at the University of London in partnership with the Arts and Humanities Research Council and the British Academy. Events are mostly online this year, and you can find the full programme at beinghuman.org. The festival can be found at Being Human Fest on Twitter, Instagram and Facebook, and the hashtag is BeingHuman2020. Please help us to keep the festival free and to improve it for future years by taking a moment to fill in a feedback survey, which you'll be sent by email tomorrow. Now, on to tonight's discussion, what's in a face? We're going to be exploring the meanings of the face and face transplants from the perspectives of surgeons and artists, actors, activists, and people living with visible facial difference. Since one of our guests wasn't able to make the main discussion, our recording's in two parts, and it will be followed by a live Q&A session with all the panelists. The event has subtitles for those who require them, and please note that we're using Zoom live captions, so accuracy isn't guaranteed, but the event is being recorded for our website, aboutfaceyork.com, where the subtitles will be finalised. For those joining via Zoom, you can ask questions at any time by typing in the Q&A box, and you'll be able to see those questions and comment and upvote questions you want to see answered. In addition to the webinar, we're streaming this event on YouTube. If you're joining via YouTube, please type your questions in the live chat and we'll pick these up for the Q&A. Finally, a note on images. In accordance with AboutFace ethical policy, we're not showing any graphic images of facial injury or surgery tonight, but we will share a web link in the chat that leads to the extraordinary artwork of one of our guests, Eleanor Crook. If you want to see how sculpture can inform our understanding of this sensitive and emotionally impactful work, then click on the link. Now I'm going to hand over to Professor Roger Kneebone, who will introduce himself and the rest of this evening's panel. Thank you, Roger.
I'm delighted to introduce our conversational group, and in a minute I'll ask them to say a bit more about themselves, but just to give you your bearings, I'm Roger Kneebone, and I'm joined by the actor Adam Pearson, the surgeon Dan Saleh, and the artist Eleanor Crook. And between us, we hope we'll be able to explore a number of different perspectives on the face and all its complexities from these different points of view. So I'm Roger Kneebone. I'm a surgeon and a GP by background, but now I work at Imperial College London, one of the large London universities, and my role is in surgical education and engagement science. And alongside that, I jointly lead a Centre for Performance Science with one of our next door neighbours at Imperial, the Royal College of Music. So I'm going to ask each of our panel to introduce themselves in turn. Adam, perhaps I can start with you.
No, absolutely. My name is Adam Pearson. I am a presenter, actor, and campaigner. A lot of my presenting has been doing documentaries about things like medicine, facial difference / facial disfigurement, eugenics, and such. And a lot of my campaigning is also around representation of disability and visual difference in the media, both off-screen and on-screen. as well as in wider society.
Thank you. Eleanor, perhaps I can go next to you.
Yes, thank you. I'm Eleanor Crook. I'm a sculptor, really, and a wax modeler, and I've got a special interest in anatomy and pathology. I'm sort of long-term artist in residence at the Gordon Museum at Guy's Hospital, where they have a historic wax collection as well. I trained as a portrait sculptor, actually, and I quickly realized that in order to be able to do that well, I'd need to understand what the face is actually made of and how the soft tissues on it relate to the bone underneath. And I just got more and more interested in facial anatomy, which led me to get requests, I suppose, from museums, and I've ended up making certain models that commemorate advances in reconstructive plastic surgery.
And I think reconstructive plastic surgery is a good way to introduce Dan Saleh.
Yeah, thanks, Roger, and afternoon all. I'm Dan. I'm a head, neck and facial plastic surgeon in the north of England, in Newcastle. I mainly deal with adult cancer work, and I've long had an interest in facial surgery and the concepts of facial transplant and the surgery that kind of involves. And I'm actively engaged in research in the area with my colleagues who have a strong background and track record in this area, and also with the AboutFace team in York, particularly looking at the psychosocial aspects of culture and attitudes towards face transplantation and what they may be.
But I wanted to start by thinking this idea of facial transplantation. I'm sure we'll talk about it more in detail in a while. But just to begin with, it seems to me that that this is something that for a long time was perhaps inconceivable. I know it's been done in a number of different parts of the world now, but not in the UK. But Dan, I wondered, could you just give us a bit of a sense of what a face transplant might actually be?
Well, I think the experience that's out there in the world thus far is that it seems to be reserved for patients that have significant facial difference, whereby the facial function, for example, the ability to see properly, eat properly, use a mouth properly, hear properly potentially, has been diminished so significantly that on balance it's been felt that exposing the patient to a transplant to restore facial form and function is a worthwhile exercise. And I think on balance, that has many facets to it, not just the technical aspect of doing that, which involves finding a suitable match, much like we would for kidneys and livers and hearts and lungs and so on, for compatibility reasons, but also a willing donor or family of a prospective donor to provide the tissue for a face. And that can vary from being the soft tissues of the face, which would be the skin, the muscles, the nerves, maybe the salivary tissue underneath all of that, to including those soft tissues plus bony structures in the face, eye sockets, upper jaws, lower jaws, and even in some cases, additional pieces of tissue like a tongue. And putting all of that together, that has been the endeavor that's been with us now for some time, actually, in the realm of face transplantation.
If you're thinking about doing a face transplant, there is the technical side, I suppose what you think of as the plastic surgical skills of joining things and putting things onto somebody else. But then there's also the whole question of the possible rejection, the immunosuppressant, the drugs that people need to take, I imagine, for the whole of their lives.
Absolutely. I think perhaps you're absolutely right. And some of the preliminary work we've done with public perception who haven't had a transplant or don't know somebody with a transplant of a solid organ feel that it's quite a transactional thing. And you're absolutely right. I think there's probably a few things to say, which, and these are, in true Twitter style, my views only, is that I feel it's clear that the science of immunosuppression and acute and chronic rejection lags behind the technical ability to do a face transplant. So one of the major advances, I would argue, in modern surgery has been the ability to transplant tissue from one part of the body to another, which we do routinely in cancer reconstruction, whether it be reconstructing breasts, pieces of a face, a leg, whatever. And that, that's a simple transaction where we divide a piece of tissue and retain its artery and vein that nourish it, and plumb that into an artery and vein in the area that we need it. And face transplants much the same, in that we're hooking up blood vessels to keep the tissue alive, but obviously it's not from the same person, so there isn't the immunogenic issue. And there's no doubt our science and understanding lags behind the ability to do the operation. For us to have any scientific progress, one has to be willing, and that requires buy-in from patients, from their public, from other clinicians, to push the boundaries and to see what's possible.
So, well, thank you. I mean, I think that raises a whole lot of things that I will be able to explore in this group, because, the whole idea of what's in a face is looking at several perspectives. You've talked about what many people would think about as a sort of craftsmanship aspect of actually, as you put it, plumbing in, or sort of taking a face from one person to another and making sure that everything that should be connected is connected. But I guess you're used all the time to doing things of that level of precision and complexity.
Joining small nerves together to make the facial muscles work again, we do that very frequently. Joining bits of skin together to form a lid, to support muscles in the appropriate way so they can work correctly, forming lips that, can purse together, can manage to eat, can manage to drink, having competence lips. They're all things that we battle with day in, day out with our patient cohorts.
Eleanor, you have a different relationship with the face, don't you? Because you're kind of converting it from people into images, three-dimensional images, often in wax.
What I'm trying to set up when I make a face is an encounter between this object and somebody who's going to look at it in a museum, wherever. And that encounter, I have to make the face look very convincing, because I want the person to almost feel as if they're meeting another person. And this goes back to some of the very old sort of religious categories of sculpture, where meeting an icon, meeting in a statue is meant to feel in your heart like meeting a god or meeting a famous person face to face. So I suppose when I'm making sculpted faces, my fingers immediately get involved at this moment, because sculpting all for me happens right here. I'm very aware of what little tiny movements and changes you can make that completely alter the atmosphere and, to the viewer's point of view, the character of the entity that I'm imagining I'm portraying. There's something quite, I don't know, it is almost like making a person, not making an object that stands in for a person. And it's a very particular little avenue of sculpture I've tried to go down, is to make these personalities rather than beautiful objects.
Are you representing an actual person in your sculptures, or do these come from your imagination?
I have a span of stuff that I make. I do make sort of standard portrait sculptures to commemorate people, and for families to have memorials of people as well. And that's quite straightforward. That is just trying to make a good likeness and to produce a facial expression on that likeness that the person associates with their, a nice personality they remember. But I go right through making medical models for wax collections in medical museums that tell you about anatomy and plastic surgery, and then all the way through to, I suppose, the most fine art stuff I do, which is a sort of uncomfortable surrealism.
But I imagine it must be based on very close observation, as well as the ability to do this very precise, focused, constructive work with the sculpting.
You can do it just with calipers. If you took enough measurements, you could do it, and that's how a computer does it, by scanning and producing. But I've always thought, actually, it's more like being an impressionist, an actor who's an impressionist and takes on the habitual facial expressions, mannerisms, and personality of who they're doing the impression of. You're doing that, but with your hands in a material. And that's the knack that sets it apart from just a cast of somebody or a computer print.
Because I know whenever I've seen your work in museums or galleries, it has an immediate impact. I perceive it as a person, and I respond immediately to that person's face, particularly as a whole. But Adam, you've got a rather different perspective, I guess, because of being an actor clearly with a visible facial difference.
So I think we all have a relationship with the human face, and none is more intimate than the relationship we have with our own face. And I think as a society, we've lost sight of the fact that everyone's face is supposed to be different. That's just how genetics and evolution has played out. But when you're on either side of the bell curve as to what is deemed as societally acceptable, that relationship becomes a lot more complex and a lot more tumultuous. And because of the progressive nature of my condition, my appearance is forever changing, and I'm always in and out of surgery and what have you. And so it's always a case of having to reassess and re-accept and redefine how you feel about your appearance, whereas that doesn't necessarily redefine who you are as a person, or your innate characteristics or skills or personality.
Presumably when people encounter you for the first time, or they're not expecting it, because you're quite away from the normal variation, if you might call it that we all have.
Yeah.
There's work to do, is there, in sort of people coming to recognize that and to respond to it?
No, absolutely. I always say I have a great affinity with supermodels, because we're both on either side of the bell curve, where we're not in that kind of 97%. And it's a case of how do I normalize that, or at least engage people to have the conversation about it without it necessarily falling into those tropes of oh, you're really brave, this must be hard, can't you get surgery for that? There's a massive misconception that kind of facial reconstructive surgery is the quick fix and the be all and end all.
But then I guess there must be some people, I don't know if you're one of them or not, for whom the kind of issues or being at that place in the bell curve means that they have not only sort of visual impact, but maybe people have difficulty in swallowing or hearing or whatever it might be that Dan was beginning to allude to. I mean, at that point, then presumably different issues come into play.
Oh no, completely. And I'm by no means against medical intervention or plastic or reconstructive surgery. I've had about 39 operations now for those reasons, to kind of make sure that I can see out of my good eyes, that I can swallow, that I can talk, and that I'm not putting myself at risk of further complications or even death. I just sometimes worry as to kind of how far is too far. But I suppose what I'd like to ask both yourself and Dan is, where do you see the line between medical innovation and, for want of a better term, mad scientist?
I think the default position of medical professionals has always been, I see a problem, I need to find the solution, without really considering what the patient's views may be, what that patient's family's views may be. And in the realm of facial difference, the way that I've been taught as a trainee, and even immediate consultants that I work with that have been in this trade much longer than I, is how valuable the parallel psychosocial support for patients is to surgery. And actually, we should really invest far much more time as a society and as a profession in normalizing the fact that many people look different, whether it be just how they're made, whether it be genetics, disease, injuries, whatever. Number one, so acceptance. And then number two, for those that may struggle with changes in facial, for example, appearance, or changes in facial function, and they have a long-standing facial difference that can't be corrected, how can we help them adjust to that and to normalize it for the people around them and their everyday work? That's far better than anything we can achieve surgically.
I completely agree. I've had, obviously not now, I'm an adult and the ethics are very much caught up. But as a child, I used to walk into hospitals and then surgeons would see me coming and kind of like start rubbing their hands together probably with Coldplay Fix You kind of playing silently in their head. But no, I'm really glad to hear Dan say that, and I'm completely on board with that school of thought.
I mean, Eleanor, I was just thinking with your work. I mean, here Adam's just been describing himself at one side of the bell curve, if you like, and the supermodels on the other side of the bell curve. I mean, in your experience, you must be creating images, if you like, three-dimensional, of people all over, at every point on that spectrum.
It's true. For portraiture, the most difficult commission for me would be probably something like an 8-year-old young girl facial type, regular. The curves on such a face are so gradual and subtle and kind of uneventful that it becomes very difficult to convincingly sculpt that without making it look kitschy. So the ideal sort of portrait subject for me would be somebody with quite a craggy face, really. So lots of events, lots of topography, lots of personality, and lots of facial expressions that you could really, call the personality out through.
I'm not sure quite how to express this, but in the way that paintings capture something deep about somebody, then your sculptures do something similar, don't they?
Well, I don't want to wax grandiose, but you really have to try, even if you don't achieve it, you have to try to capture who they were in the past, who they are now, and who they will be, and how they will be remembered. And you have to try and capture, I think you can do it as well, several facial expressions on one face, so that when the lighting shifts or when the head of the viewer shifts, look round that head, different emotions slightly flicker across the surface. And it can be done. It's just a lot of very subtle tweaking of little facial expression markers.
And that's something that's going to be static because it's a wax sculpture. But Dan, when you're operating on people, I'm not talking about face transplants necessarily, but it must be even more difficult, I imagine, to think how it's going to work when people's faces are moving again.
Yes, and I think that one of the things that we always try to do is there's some very basic principles, that things that have stood the test of time, like trying to replace like with like. What can you do as the surgeon to control the level of scarring, because scarring changes how the tissue behaves. And then actually a major part of that is just not the technical aspects of trying to do the best job and be millimeter perfect with the putting back together bit, but also warning the patient that despite your best efforts, it will not be the same, and the things that they may notice that aren't the same, because you have to sow that seed of preparation in advance of the operation, because then if one doesn't do that, in my opinion, the psychological impact of change is quite great. We want to leave the smallest footprint of surgical meddling that we can.
Well, go back to that point about what is exactly right. Adam, I wanted to ask you about what is that process of aligning what a surgeon might think you need and what you think you might need?
Well, whilst actually what Dan alluded to as the art of surgery is very much a great skill, another skill that I think all medical practitioners, be they surgeons, dermatologists, cardiothoracics, whatever, need is a good level of communication. So you also kind of talk to the patient as a person rather than just a caseload. Surgery is an intervention. It's not a quick fix, and there's always going to be a trade-off. It's not you gain everything, you lose nothing, and it's all about kind of knowing that going in and getting out of this heavily media pushed, romanticized idea that if you have kind of depression and anxiety and you go in and get like a boob job or a nose job, you'll come out of it without any of that depression or any of that anxiety.
But facial surgery is completely different, isn't it? Because whatever happens, however small, Eleanor, as you were saying, these tiny, tiny things make a huge difference, don't they? So I was wondering whether maybe Eleanor and Dan, both of you, you must have an additional layer of awareness for what your work is going to do in terms of how other people recognize it and the sort of immediate human impact of a face.
I think it sort of ties into what I mentioned before, is that if you're embarking on a situation where you're going to deliver an operation or there's been a traumatic episode where there isn't lead-in time to counsel the patient and to prepare them for what the differences and the changes may be. Having psychological support for the patients, a whole sort of holistic support, not just the transactional nature of doing an operation and recovering from it, is so valuable. And I think that ties into our cultural norms.
Eleanor, I know that your work it kind of crosses boundaries, doesn't it? Because it's sort of medical and sort of isn't, and it has to be. I mean, I know some of your work I've seen has been very shocking work, recreating some of the injuries that people suffered in the First World War, for example.
When I look at the historical models as well, you know, the historical waxes we've got at the Gordon Museum, what often interests me most about them is how little of the actual model in front of you is actually about the anatomy and how much is about the human drama.
They are a fascinating example, aren't they, of very high levels of craftsmanship and artistry, but also anatomical accuracy.
All over Europe since, I suppose, the late 16, early 1700s, artists and surgeons have collaborated together to make permanent models of complicated anatomy that just doesn't last when you want to teach from it or learn from it, especially in hot climates. So if you sort of travel around Europe, you can see these beautiful medical wax collections whose anatomy really does stand up to scrutiny. And in London, we have a collection that was made by a modeler called Joseph Town from Royston, who spent his whole life working in a basement in Southwark, creating these extraordinary, permanent, anatomically accurate bodies, half cast from real specimens and half very skillfully modeled from personal observation. And when you look at these bodies, they're just a fraction off being people as well, because all the evidence of who they were and what kind of physical life they lived is still there in the object.
I mean, these days we think a lot about, or a lot of people think a lot about images of themselves and one another, and I think there's a lot of anxiety, isn't there, about the extent to which people do or do not conform to a sort of ideal of what people should look like, and selfies and images and social media, all that kind of stuff.
I think ultimately it comes down to media literacy. And whilst you might, you look at all these images that are all bombarded with every day, even subconsciously. Photo you're seeing on Instagram, that's a supermodel who is already in the 0.01%. And that photo's already been airbrushed to high heaven. And so it's a case of accepting how you look, who you are, and those circumstances, and being the best you can be. At least that's who I am. I am psychologically. And I know it's a lot easier said than done, and that pragmatism can only get you so far.
Looking the way you do, I imagine that must open some doors that are closed to other people, but close other doors that are open to other people.
And a lot of the jobs I've gotten in presenting and acting and even this is predicated on how I look, but not solely on how I look, but the experience and the worldview and the expertise it has given me. And here's like a really, really weird thought that I kind of want to throw out there. Everyone talks about how hard it must be going from being kind of normal, kind of quote unquote, to being kind of disabled, disfigured, different, whatever vernacular you want to use. And very few people discuss how hard it is to go the other way. And that adjustment period works both ways, but not many people think about that. They only think about it as a transactional, solving problems kind of way.
And Dan, I wonder about that, because you must deal with a lot of people like that. And I wondered, in reality, there must be a whole lot of things that you're having to balance.
Yeah, very much. And I think there's two facets to that. So certainly what I just want to pick up on something that Adam said about what happens when you go the other way, when you've lived with what people perceive and you've been taught to perceive as the individual, a facial difference or a visible facial difference, and then somebody does something, or even a face transplant changes that, and you have a total new identity which people perceive as a norm. That's something that we, or actually I say we, I have neglected in my practice when I first embarked on my interest in facial transplantation as a trainee. That is a huge impact on the individual when you go from what you've known potentially all your life with an acquired benign condition or congenital, or something you're born with, genetic condition that's benign, to suddenly changing you to something that people have been telling you for years, this is the norm, what you've got isn't the norm. Well, actually, there's genetic difference that runs throughout our whole society. So it is actually a form of norm. Like Adam said, it's on a different part of the curve. And that is really fascinating, because people think that when you take a transplant from somebody and put it on somebody else, we forget that it takes their facial form in terms of what their skeleton and the scaffold is like underneath. And then that brings up whole issues about, will you warm to your new identity? And whilst there's huge amounts of psychosocial support in place for the patients that have had face transplants that we're aware of in Europe and in North America, we haven't teased out what that reaction is to your new face and your new being. For those that aren't blinded by the problem that warranted a face transplant, unquote, quote unquote. And that's something that we have to get right, because actually, if somebody's very comfortable with what they are and they don't have major functional issues, who are we to dictate what's appropriate? And we can't be paternalistic about that. That has to go out the window. It has to be very much shared decision making, or actually driven by the patient, provided they understand the risks.
There is a sort of intersection here, isn't there, between all kinds of different perspectives, surgical in terms of the technical side, and then the psychological side, and the sort of human side, and these all these other things that are going on at the same time. Adam, in all your experiences, do you feel that all those elements have been addressed?
It has become a lot more holistic, where if I go in and say to, like, Simon something completely stupid, like, kind of, I want a big chin and horns, he'll be like, I wouldn't do that if I was you. And, you know, we'll thrash it out properly. And so it has gotten slowly more, as I say, holistic. But there's a real allegory here between the human face and the debate we are now having about it. That they both have a lot of moving parts that don't work, that kind of almost coexist and work kind of codependently of each other. And if you do neglect one at the expense of the other, eventually the whole structure itself will suffer as a result.
Eleanor, I wanted to ask you, because we're talking about moving parts figuratively, I know, but also literally in terms of people's faces. You're managing to capture something that is very close to the real thing. It seems to give the sense of being alive.
Well, I'll start by saying, before I did sculpture, I did classics years ago. I did Greek and Latin, read the literature, and particularly studied their statuary. To vastly generalize, there's a period when their poses of their statues are very static. There's a period when the poses of their statues are very dynamic. But there's a really interesting period just on the cusp between those, when they specialized in the pose of somebody who's just about to do something. So just about to throw a discus, just about to speak. And it's a sort of telling moment that if you can somehow capture it in a sculpture, it gives this illusion of movement, even more so than drawing somebody in the middle of a full dance. And I think that's the moment I'm always trying to get. It's that sort of pregnant pause before somebody tells you a secret. It's that moment just before something bursts out from behind. But the actual putting of life into a sculpture, I mean, that's a sort of voodoo. People have believed in this for centuries and tried to activate statues for centuries. And I think there's a little superstitious corner of my mind that just about believes in it.
So Dan, as a plastic surgeon, are there those little tweaks that you can make to the corner of an eye that you know are going to, I don't know, they're going to create the effect that somebody wanted or that you wanted? I think you just have to wait and see.
I think it's always better to wait and see, because like I alluded to afterwards, there's always the appetite for more from the surgical perspective. And sometimes, I have to confess, it may get blurred to what we want to be better and what the patient may not seem as better. And more is not necessarily better. And it's a process. And I don't think you get taught that very well as a surgeon. We certainly in head, neck and facial surgery, we don't get taught that. And sometimes you have to step back and let the narrative be taken forward by the patient.
Eleanor, I wondered if there was something like that where, you were tempted to make just one other little change and then it lost it, or is there a balance or a dividing line that you have to be aware of when to stop?
Well, listening to Daniel, I've suddenly realized what a terrible surgeon I would have made. I'm very poor at impulse control, and I know that something could be just a little bit more. I think for me, the time when I pull back and stop is at an ethical moment. It's in the ethics of what you're portraying, for whom, where, and why.
So for people who are not familiar with your work, say a bit about it, because I think it sort of ties into a lot of this that we've been talking about.
Yeah, the Hunterian Museum at the Royal College of Surgeons of England in London, and then later a museum of history of medicine in Ghent in Belgium, asked me for wax sculptures that showed progress of reconstructive plastic surgery in times of war, specifically on soldiers, looking at old military medical archives. So I went to the Gillies archive in Sidcup at the time and looked at really the history of how facial surgery developed in that extreme time of acceleration of its development that was the First World War, because there were so many people to be operated upon. And I looked through loads of archives of anecdotes, surgeons' notes, photographs of surgical subjects, and came up with, first of all, a model with lots of different operations all happening on one bust at once, on one head. And then I did a set of 5 soldiers from different wars with different operations appropriate to their period. And I presented them as a brass band playing together instruments that unfortunately their injuries would have meant they couldn't have played, but they were willing to try and do it.
Adam, I wondered, from your perspective, I imagine that people, when they first see you or whenever they see you, will kind of frame you in a particular way.
So I think normality is relative. So whilst how I look might not be normal to other people, for me, it's all I've known. I wake up in the morning, I look in the mirror, I do my hair, I click my fingers, say that you're nailing it. And like I say, it's all I've known. And so it doesn't register to me until someone else brings it up. And then when you meet people for the first time, I can understand why people would be a bit kind of awestruck, shocked, taken aback by the whole thing, because you don't see it every day. Even for my own condition, I'm right at the on like a 1 to 10. I'm very much a 10. I jokingly refer to myself as the spinal tap of my condition. I'm turning it up to 11. And so in that moment, I've got to do a lot of really heavy, hard communication work really quickly to bring that anxiety level down. Because it's those levels of anxiety and curiosity that if they're not addressed quickly and effectively, but with also like a great deal of kind of love, compassion and humility, without throwing loads of complex medical jargon around, those emotions, when left unchecked, eventually become prejudice and hostility. And that is much harder to fix.
It seems to me that a transplant really magnifies a lot of these things, because all sorts of things will be happening at once. To what extent do you think in the world we've thought through these things?
My sense is that perhaps we embarked on these notions when we look at patients and think, well, how can we help them adjust to their facial difference or their major problem? And maybe, as I've alluded to before, we need to really make a huge effort to get the people around such people to adjust. It's not the individual that needs to adjust to how they look or how they may look. There is no doubt to me that there are patients that will benefit, well, that have and will continue to be in a very, very small group that benefit from the concept of facial transplantation. The issues that we have is that we don't know what forms of psychological support, how much, and what tests to do for patients before embarking on this to ensure that they will be able to withstand the changes that a facial transplant may mean. And the million-dollar question, I guess, is at the moment, is will changing your facial appearance in the realm of a facial transplant be beneficial to you and outweigh the likely scenario of a chronic rejection episode in your life, in your natural lifetime?
As a sort of rookie question, does that happen with hearts, livers and kidneys as well, or is it something peculiar to large tissue allografts, as you said?
Yeah, so to contextualize that, with a broad brushstroke, a significant number of solid organs will also enter chronic rejection. And those pathways are better understood. They can be mitigated against perhaps a little bit better than allotransplant can. And certainly in the context of a kidney transplant, much like a face in its broadest, in a very, very basic sort of way, it is a lifestyle choice. Dilemma with the face transplant is that one can live with the face that they currently have, or the patient in theory is living with it, albeit maybe in not the most fantastic way. And so are we inviting a whole ream of problems that they may have with immunosuppression and the inevitable chronic rejection at the cost of maybe some temporary benefit in their psychological well-being?
So you're saying that if somebody has something sufficiently seriously wrong with them to warrant considering a face transplant, the first question is, would they be better off with the injuries or the damage that or the disfigurement or whatever that they've already got, rather than and not having to have immunosuppression and these risks of the thing failing? Could that be a better option than going for a face transplant with all its uncertainties?
Oh, very much so. And you know, I think, I would hope that the teams that are carrying out facial transplantation, I certainly know the team that I spent time with in North America do, invest significant amounts of time imparting that concept to patients that, look, this could threaten your life in the immediate short term after the operation. You could get overwhelming infection because of the immunosuppressive drugs we have to give you to accept the face that might make you extremely, extremely sick to the point where you die. And so that needs really robust workup in the psychological and surgical sense, and more so as well that they understand the long-term effects. And then I think one aspires to remove a bit of that medical paternalism or maternalism, and it's a joint decision-making process where you feel that you've ethically imparted the genuine pros and cons on this situation on the patient. And there is a small, and I do believe there are small subsets of patients out there that would probably benefit from face transplant. I just wonder, is when is the right time to hoist the flag and say, you know, the whole world is open for business doing face transplants based on the early experience, because the immunosuppression, you know, in the background is an issue, and the chronic rejection is an issue. And do patients really, really understand that? And do clinicians really, really understand that? And that's where I wonder, yes, in 100 years' time, I'm sure that it will be a totally different situation, but we're not there. We're not there yet, and so it's a good time to be tentative, I think.
The impression that I think some people have is that if one person has a face transplant and another person's face, if person A has a transplant from person B who acts as a donor, then after that operation, person A will no longer look like they're used to as person A, they will look exactly like person B. But from what you were saying, it's not as simple as that, because there's very often the underlying bone structure of person A will still be there. And so a new face will not just be translating another person to make them look exactly like that other person. And I wondered what happens if that's the case. Then if a face transplant fails and they have to have another face transplant, whether they will end up more or less looking like a slightly different version of their previous self anyway because of the bone structure, or whether they will look completely different each time and have to come to terms with a different identity.
Yeah, and what, as Adam alluded to before, taking someone the other way, in inverted commas, and Eleanor alluded as well, like, you know, the plasticity of the soft tissue aspect based on a finite scaffold is that very much so the patient will take on a new facial identity, that their nearest and dearest will have to adjust to, will have to accommodate, and they will have to learn to have a different facial appearance based on aspects of a donor, but based on their scaffold. So it will look different in moving both ways. And then, yes, you know, it's entirely possible, based on the current knowledge base we have, that in subsequent years, if chronic rejection troubles them, that they may well end up in a situation where they need another transplant, which will mean that they take on another identity in another facial form.
I wanted to finish by asking each of you, you know, what you think about face transplants now that we've had this conversation.
It's definitely a learning curve, and I think it's really important that we, again, manage expectation and don't rush into things foolhardily. And both yourself and Dan alluded to it earlier, whereby as surgeons and as medical professionals, it's important not to go in and try and be too heroic, and kind of take time, do due diligence, and always keep it patient focused. And as long as conversations like this and a strong ethical code is put in, and all those things are all happening at once in a cohesive way, then I'm all for it. If ultimately, and again, Dan said this right at the top, if it's a very specific case that helps a person live a life they otherwise wouldn't have been able to for whatever reason, I'm all in favor of medical intervention.
Because I mean, I guess there is a tension between trying out something new and not wanting to make things worse.
Yeah, there's always a trade-off. Nothing comes at a cost, and as long as that risk-reward ratio is very much kept in check and is very clear, very transparent, and no one's off playing, as I said earlier, mad scientist. I don't want face transplanting to go the same way that human embryonic fertilization went at that very notorious conference in Hong Kong years ago. Face transplanting should avoid going that way at all costs and be very transparent and ethical and patient focused.
Thank you. Eleanor.
Everything you just said on the ethical dimension, I can't say it better and completely agree. I imagine a time when the technology of it is so perfect that it can be done really beautifully well, and how people will respond to that. And I think, rather like space travel, it's going to become one of those human adventures. It'll give the recipient the opportunity to feel a particular unusual kind of gratitude. I saw a lovely piece of footage of the recipient of a facial transplant meeting the parents of his donor, the young man who died. And they meet, and it's very unnerving for all of them and very emotional. And they sort of tend to agree between themselves that it's a completely new human experience. Nobody's ever experienced it before. And they're experiencing, likewise, emotions that are completely new as well. But it's not unpleasant. And they feel that there's almost been a third person created who belongs both to his own parents and to his donor's parents in an unusual and special way. I thought there was something rather lovely about that idea. There's some sort of, it sort of extends a person and extends their family by extending their body into two persons, you know, two spirits that were previously separate. There's something new has been created that's a mixture of them.
It's a very moving perspective.
And that's a completely new thing, which is why it's so exciting, and why, in spite of all the drawbacks and the dangers of chronic rejection and the difficulty in the technology and the pain involved, I think it has to be worth doing.
So Dan, perhaps we could leave the last word with you.
5-6 years ago, if someone said to me, you can be part of this kind of service or delivering this kind of thing, would you want in? I would have said 100% yes. And that was a different time for me, a different level of maturity, a different level of going out on my own as a consultant surgeon, and now I feel a lot more guarded about it. I do believe in it. I do believe in the surgery of it, but I feel that it will be effective and very good in the hopefully near future. But I feel that we need a bit more due diligence. I would like us to focus some of our energies into adjusting the public and what we term normal to what we perceive and what we term as abnormal, and rather and not expect it the other way around. So not expect people that have visible facial difference that, oh, you're well adjusted, aren't you? You can cope on your own. Well done, you. It should be the other way around, actually. And I feel that we can do that as now a society, and I think that's going to be so valuable for us moving forward. But I do think face transplant is here to stay, but I'm anxious about it, and I really want to see how it plays out in the coming decade.
Well, thank you. I mean, I feel that we've only just begun to scratch the surface, and we could go on talking for hours and hours about all these ideas and the issues and the challenges and the opportunities that it raises. But we can't on this occasion because we've run out of time. So I'd like to thank you all for such a fascinating conversation. Eleanor Crook, Adam Pearson, Dan Saleh, for taking part in What's in a Face. Thank you, all of you. Goodbye. It's a great pleasure now to welcome Tulsi Vagjiani, who was unable to be part of our first conversation about where we explored a number of issues around the face, around face transplantation, around responses to people who experience visible difference in various ways. Tulsi, first of all, welcome to this conversation. And I thought I'd ask, if I may, if you could just give us a sense of your life and how you've experienced the whole question of visible difference.
Hi, Roger. Lovely to meet you. So I sustained burns in a plane crash when I was 10 years old. So this is my visible difference, scars on my face and my body. And living with a visible difference has been really difficult, because again, everything's based on the external, of who we are. And, it's the bullying and the name calling, people crossing the road. So these are the kind of things that I endured. That sort of led me to where I am today as a motivational speaker and inspiring people to look within and accept who they are. As much as our face is obviously very important and part of our identity, it doesn't define who we are.
Thinking back to the conversation, the earlier conversation where one of the participants was Adam Pearson, very well-known actor, the condition affecting how he looks is one that has developed gradually over the years. Whereas in your case, it was a completely sudden, unexpected event, wasn't it? Your plane crash, which suddenly changed everything at the age of 10. And I'm just thinking about how different an experience that perhaps that was.
Yeah, absolutely. I think, up to the age of 10, I never really thought about my looks because I was just being a young girl in school, wanted to hang out with my granddad and my dad. They were like my inspiration growing up. And it's not something I thought about. Like, I think in the sort of time that we are now, especially like with social media influences and things, I think there's a lot more emphasis on how we look from a lot younger. But the age 10 back 30 odd years ago, it wasn't such a big deal. I never really worried about whether I was short or tall or, I didn't have much emphasis. So, but now all of a sudden at the age of 10, suddenly my appearance is a big deal. I think it's a lot different growing up from a child to maybe, let's say, as an adult. Because as an adult, you've got used to how you look. You've got used to, how everything is in place. But from a child that was about 10, it's a dramatic change. But I think it's a lot different when you are sort of either born with it or you have it from a really young age. I think also going back to, I think if your support system is really good, that also does help because they're giving you that positive regard, And I think that for me was missing because I would have probably got that from my parents. So although I did get it from family members and friends, I didn't necessarily feel it because primary people who was meant to give that to me was missing.
So you were having to cope with not only the physical change and your injury and all the sort of medical sides, if you know what I mean, but also this what must have been an unimaginable, devastating loss of your close family at the same time.
The nurses and my surgeons and doctors, they became my comfort because they accepted me for me. I wanted to hold on to that, you know. So every time I got admitted into hospital, I felt really good. I felt really safe, you know. Obviously, the journey to and from hospital was very difficult because of the bullying, you know, people crossing the road, people calling me names, young children throwing things at me to see if I have emotions or reactions. So enduring that, but as soon as I got to hospital, it was like a safety. And I think having to deal with not only the physical change, but the emotional impact of the accident and, well, the loss, I think all of that encompassed together, I did feel like a real, you know, my self-esteem obviously hit a real low. And I just did struggle for such a long time to build that. And I think one thing, you know, what we don't realize or put emphasis on is that having any kind of visible difference, you don't get to take your visible difference off. You know, I don't get to take my scars off and say, hey, I'll cope with you later. It's every day as I leave my house, I check in with how I am within myself, and whatever reaction I'm going to get external to me, how am I going to cope?
I know that a lot of your work now is about being a life coach and a motivational speaker and helping other people going through difficult times. From what you're saying, this is far more about an internal process that sounds as if you had a pretty sort of bleak time to begin with, but now you're able to support other people in going through that process. Is that fair?
Absolutely. Like, I've had to do a lot of work internally to accept the external, to which now, you know, I wouldn't change it for anything. You know, I absolutely love my scars. For me, you know, they decorate my body, as I like to call them, my gems. But getting to that acceptance level took me a real long time. But I recognize that even a lot of my friends and family who don't have a visible difference are also striving for that, you know. So yes, people will stare now, you know, but that doesn't affect me like it used to.
And I was interested when you said, I love my scars. I wouldn't change them for anything in the world, because I'm sure not everybody thinks that about how they see themselves, and I imagine how they perceive how other people see them. I wondered if you could say a bit more about this, maybe this process that you went through to reach a point of loving your scars and being, I suppose, almost comfortable with where you are now.
Either naively or even optimistically, I thought there's a magic cloth. In a year's time, all of this will go away. As we learn, you know, that's not how scars disappear. At the age of 10, that's just kind of where my mindset was at. Somehow along the line, we're conditioned for this perfection, whatever perfection is, you know, and I was seeking it. And so everything about me, I just disliked. And a really good friend of mine, he said to me, you know, Tulsi, I really love your crooked smile, because I said to him, I hate my crooked smile. He goes, but that's what I find endearing about you. And at first, I just couldn't grasp that. But everything that I disliked about me, somebody else found that endearing. And so I started to learn to accept it and start to look at that crooked smile as if, yes, that is mine. You know, it doesn't belong to anyone else. That's mine. So that all helped towards this confidence. But it took a long time, because growing up in a South Asian culture, you know, from an Indian heritage, everything is based on the external. You know, we our sort of role models are these Bollywood actors and actresses who, you know, wear a lot of makeup, are in this film industry. And if we're striving to look like that, and I have a scar, I've got no chance. But that's what we were fed to look up to. So years and years of hating myself, maybe starving myself, doing lots of things to look like that. It was really lonely. And, you know, in the South Asian culture, the first thing anyone comments on is the face. Oh, really dark. Oh wow, you're so light and pretty. You know, so much has been fed into us to what is beautiful. I didn't fit any of that, you know. So I had to work through all those negative labels to come to a point and say, actually, this is who I am. You know, no amount of surgery or anything's going to change this. Sure, you know, I've had laser treatment for my scars and it's made a massive amount of improvement on the functionality of the skin. But in terms of the way I look, nothing's really going to change that. But that's okay. I don't want to change that anymore.
Yeah, so it was interesting when Adam Pearson was talking. He was saying that, you know, from his point of view, everybody is somewhere on a bell-shaped curve, and I thought that was an interesting way of looking at it. These differences, you know, they may seem very great in one way, but in other ways, as you've just been describing, I think they're actually they're just one part of a much bigger picture of who people are, not just what they look like.
Absolutely, and even these people that we want to strive to look like, you know, they're going through their own journey of their own acceptance, because how do we know that they feel that good about themselves as we portray them to be? You know, we all got different dialogues going on, but I think we're all trying to find this inner self-confidence in whichever way it is. Now, whether you have a visible difference or not, we have, you know, everybody has invisible scars, for example. So even with those people who have those type of dialogues, they're still striving to get somewhere. And to have this type of inner confidence where you fully accept who you are as a person, you know, from the external and internal, we all want to reach that, but some of us, we don't know how to. And I think for me, because I've had this visible difference, I can't hide from it. It's not, like I said, I can't just take it off. So I have to face it every day. So the sooner I accept it, the more fulfilling my life can be just for myself, you know.
Thinking about the idea of facial transplantation from your perspective, as somebody who's clearly given an awful lot of thought to appearance and faces and things over many, many years, what are your thoughts about face transplantation?
I think the whole concept is really amazing. It's so fascinating, you know, to be able to give somebody another lease of life, so to speak, you know. Of course, on the psychological mental side of it, it's a huge change, because suddenly you now look like a different person to who you were before. But to be able to have this opportunity to feel good about yourself again, I mean, why not? Of course, in the medical aspect, it can bring a lot of complications, you know. But on the positive side, it can give somebody a whole new lease of life, almost like a second chance to be who you really want to be. Really, it's like, here you go, you've got a free reign on who you really want to be. Go for it, you know. I think it's brilliant.
Thinking ahead to what it might involve to be the recipient of a face transplant, leaving aside all the medical issues about possible rejection and complications and things, but just thinking about what it might be to take on, well, to have another person's face transplanted onto you. What do you think that might mean in terms of who you are, and those ideas around identity that you've just been talking about?
Yeah, I think if it happened now, like say, like me as a person now, I would welcome it on the basis, because I've already worked from the inside out. So my external appearance isn't as important as it was even 5 years ago, because I was looking for approval, validation. I don't look for that anymore. You know, I'm not fussed on whether someone likes me or not, because I have to like me. And I can own that, you know, the essence of who I am is still there. So I know having a face will be different, because it's not like one you can take on and off, but it'll give me that new opportunity to embrace this new face. And I don't know, like I'd see it as a new way of life.
So Tulsi, it seems to me that you've been talking about a kind of transition. How do you think you might be able to help people to perhaps shorten or to understand the process that they would need to go through that actually took you quite a long time
Yeah.
And I don't know if there's even a moment when you can identify when it switched and you started to become more comfortable with things. How would you convey that to other people, do you think?
Yeah, for me, it was quite a poignant moment. When I first met, the Katie Piper Foundation, that was the first charity I reached after such a long time. And being in a space with other burn survivors, and I could see the beauty of them. I didn't notice the scars. And that's when I realized, oh, well, I can see myself like that. Why am I seeing myself as somebody with just burns? That's all I could see, just scars. And yet I could see my peer as somebody so beautiful, notice something really incredible about them, and it had nothing to do with their scar. And I think that's when it hit me that, I need to start owning some of these words that people portray, i.e., Tulsi, you look so beautiful. Wow, you look so nice. I started to own those words because before I would repel that. So I think having a really good peer support would be so crucial in this transition of feeling really good, in this transition of acceptance. Obviously, everybody has it at different sort of times and speed, but it accelerated my confidence in a huge way when I was around my peers and around people who just understood, I guess.
That's very interesting. I mean, I was very struck in that previous conversation about the different ways in which the people who were talking, I think, said something rather similar to what you're getting at. I just wonder whether you feel that the cultural differences you talked about at the beginning with your South Asian perspective and maybe a different set of cultural issues here in the UK. I don't know. How do those differences play out for you?
I think for me, so obviously growing up in my South Asian community, that was my first point of social, community-led programs, dancing and all of this. So it's not until obviously I've gone into school that I've met people from, different backgrounds. But even the area that I live in, in East London, it's multicultural. So it was no different. But it's when you go into schools and when you go into colleges, obviously you're going to meet so many different people. And they'll just say, oh my God, Tulsi, you look so beautiful. And I couldn't understand that because I'm like, here in a culture where I've been sort of almost called, ugly or not good looking. Because from the age of 10, it was drummed into me like, who's going to date me? Who's even going to marry me? That was such a big thing. You think at the age of 10, but, in a culture like that, it was big. So that's always been at the back of my mind. Who's going to date me? Who's even going to employ me? So then to meet my peers who, are, who are white, for example, they couldn't understand why I had such self-loathing attributes towards the way I look when they could see such goodness from me. I couldn't talk to anyone in my community about the way I felt because they're the ones that were going, well, yeah, but you still don't look like that beautiful model on TV. So of course no one's going to look at you. That attitude was there. So I've kind of had to work through those types of conversations in my mind to overcome that and have the confidence that I do today. But in doing that, I've also realized there wasn't somebody like me out there in the media, like who's South Asian with a visible difference. Culturally, we don't talk about anything. We do brush things under the carpet. As a family, I've been taught, don't talk about anything. As far as everyone knows, you're okay. So that's what I had to portray.
You're there as a sort of living example of a different way of thinking.
Absolutely. And I wanted to be able to be that role model for someone, particularly from a South Asian community who has any kind of, visible difference or invisible difference, where they haven't felt understood or heard. And they go, actually, there is someone who does look like me or is experiencing something like me. And I'm okay. This is fine. I'm not an abnormal person.
It's the way you portray the way you come over to other people as being comfortable with how you are, that acts as a kind of I suppose, an inspiration for people. But I was wondering, you know, at what point you made that shift from that state you described so poignantly at the beginning, you know, feeling you hated yourself and how you looked and you thought it would never get anywhere, to where you are now. And I was wondering how you go about helping other people to recognize where they are on that path that you've been along.
Yeah, I would think for me, like, you know, doing a lot of modeling work, you know, and again, like even a model, we'd presume they look this one particular shape and size, but you know, doing campaign work that I do, is actually, no, beauty and fashion can be experienced by everybody, you know, and this is why I want inclusivity, and that's why I campaign the way I do. But about 2015, I was able to do this catwalk with Katie Pike, who, you know, she organized it with 7 other inspirational women. And at first I just thought, oh, this is great, because just an opportunity to model. But what I didn't actually realize that it was actually going to be the starting point of confidence in a different way, because one of the outfit changes was swimwear. Now, sure, I've been swimming before, and yes, I'm always nervous of getting into the pool with a swimming costume because of my scars and everything. But when we had to do this swimwear, me being the shortest as well, so I was obviously in the front, I had to face my fear of the judgment or however people are looking at me. And it really changed my mindset in that now, if I wear a swimsuit, and I've said to quite a few of my friends who are uncomfortable in their body, I said, people are either going to look at you in disgust or they're going to look at you in awe. Either of those things has got nothing to do with who you are. That's their perception. And that has really helped me where I am today. Whatever people look at me at, you know, whether somebody goes, oh my God, look at that, or go, wow, she's so beautiful. None of that's got to do with me as a person. It's just their reflection of how they see me.
Coming back to the idea of face transplants, then, it sounds to me from what you're saying as if in that sense, a different face wouldn't really affect who you are inside. It would overcome some of the difficulties that you are obviously having in order to be considering a face transplant in the first place. But in a sense, it's your inner essence that would remain unchanged.
Absolutely. And I think that's where I had to go on my journey, because when I first had my accident, you know, I felt like, don't get me wrong, I'm not religious or anything by all means, but I thought God took my beauty away. But now I don't see that, you know. In fact, I've been given the best opportunities to work from the inside out. So like for myself, this is not speaking for everybody, but if I had a transplant today, like a face transplant, sure, there'd be a little bit of an adjustment, of course, but the inner essence of who I am would soon take over the negative narrative. Funny enough, I've had a kidney transplant, so I can understand the active rejection side. But, you know, I think personally, working from the inside out has helped me. So if in my path, you know, whatever reason a face transplant was there, I think I would personally be able to accept it based on the fact that I've worked on myself that much.
Well, thank you. I think that idea of working from the inside out is a fascinating point for us to carry on discussing. So, Tulsi, thank you so much for taking part in this conversation.
Thank you.
Thank you very much, everyone. That was a really fascinating conversation. And I'd like to invite all the panelists now to put their cameras on and join me for the question and answer session. You can ask the question in the question and answer box, and we will endeavour to answer it. While I'm waiting for people to rejoin, one of the things that really struck me, Roger, was the historical issues here. As a historian, I'm fascinated in the idea of change over time, of course, and Tulsi talked about the invisible scars that many people have. And I think that's a really fascinating way of thinking about the difference between the internal and the external idea of who we are and what we look like. And of course, that has changed over time. So along with the types of facial difference people have, the attitudes towards facial difference, and the kinds of surgical innovations that are available, these have changed over time. And I wondered what you thought, Roger, Adam, about what is it specific about the 21st century, do you think, that highlights the kinds of issues that we've explored in this conversation around facial difference and transplantation?
I mean, maybe I just start off. It seems to me that going back to what Eleanor Crook was saying with her work on that pioneering time in the First World War, with all those soldiers having dreadful facial injuries and so much happening in the world of plastic surgery, which was very much about responding to injuries that had been caused by something else, and as sort of trying to repair. Over the last 100 years or so, I think we've got to a point where surgery is very different in that we can now sort of confidently do stuff expecting to make what is already, sometimes making what is already good better, or have a much greater ability to do things that are not just doing the best we possibly can with something awful that's already happened, but hope to bring about changes. And I think what we were talking about face transplantation is all of it based, isn't it, on where surgery has got to now, where a lot of those early issues have been overcome now. And I suppose we're looking at what surgery can do from a very different standpoint from how we might have done only a few decades ago. It'll be very interesting to hear what Dan and Adam have to say about that. But it seems to me that this is not a conversation we could even have been happening, certainly in the early parts of my career. In the 70s, 80s, 90s, we were in a very different place.
Mm.
No, I completely agree. If you look at how far surgery, and particularly maxillar and craniofacial reconstructive surgery, has come, even in my lifetime, things that would seem quite scary, intimidating, and complex, and now just, I suppose, run-of-the-mill procedures that can be done with great skill, great accuracy, and great finesse. And I think it's important we do look to the future and keep asking ourselves the question: how far is too far, and where do we draw the line, or even where do we start to even consider either face transplanting or reconstructive surgery of some form. And I think surgery, and I allude more to the plastics and cosmetic more than the reconstructive now, has become really easily accessible, both in terms of being able to find a surgeon and as well as financially. And I think how we think about our faces and our appearance is greatly influenced by social media and the Instagram generation, and it's constantly being bombarded with images of perfection that's both unattainable and unrealistic, constantly. And if that's kind of what you're seeing on a daily basis, that really does have an impact on your relationship with your face. And then that will then affect your relationship with yourself and your soul. And you can wind up in this vicious circle of almost chasing the dragon, so to speak, of trying to look perfect, but then the standard of perfection changes. And so you've got to start again. And then you're in this constant stage of having to reassess your whole character based on just your face and your physical appearance. And I think it's a really fascinating thing, both psychologically and medically. And that's why it's really important that we have conversations like this and discuss it and help people both access the medical care and support they may need, but also come to terms with their appearance and realise that it's okay not to be okay.
Mm. I think what you raised is very important as well about the relationship between social media and expectation, and this idea of the aesthetic and how the aesthetic has shifted over time. And I'd like to ask Dan more about that. But just before we move on to those sort of surgical questions, I wonder, I know that Adam, you and Tulsi are both very active in exploring the ways in which we can change perceptions about appearance and the value that's given to particular kinds of appearance. And I wonder if either of you could say something about your work in this area and what needs to change.
Oh, thank you, Adam. Yeah, I think, you know, with Adam, we've done a lot of campaign work with Changing Faces. So as we know, you know, every time we hear a negative comment, it's just another reminder that we've got more work to do. You know, recently we were involved in a campaign, Visible Hate. So it's like a hate campaign. And, you know, we all had to share some of these words or experiences that we had. And when we put the whole thing together, it was really shocking to realize that we've experienced that, you know, and like myself, I didn't even know I could report this as a hate crime. And it's only just learning that recently. So can you imagine just how many people are suffering in silence? I was also involved in another campaign, I'm Not Your Villain. So again, you know, targeting the film industry, the movie industry, to not use somebody with a visible difference as a villain. Like, we don't need to be doing that. Just recently we had the movie The Witches, in which they used a woman, you know, bald and fingers stuck together. Now, I'm glad, like, there's a big campaign going around that, and, you know, Anne Hathaway actually apologized and didn't realize the repercussion. But, you know, we do need to keep working towards these kind of campaigns, because, you know, that's a woman who's lost her hair, like, you know, with alopecia, you know, she's already going through what she's going through. And then to have all of this type of negativity put towards her, or people feeling scared looking at someone who's bald, that's not how it should be. You know, we should be changing the narratives towards this.
Yeah. Adam, did you want to come in there?
Yeah, no, I completely agree. And it all comes down to media portrayals, and whether we like it or not, what we see in the media does either affect or set our expectations of reality. So when we see these negative portrayals of disfigurement and disability, they tend to fall into one of two tropes, either victimhood or villainy, and maybe a little bit of inspirational porn kind of dusted over the top of the whole thing. And for every crack of the whip me and Tulsi will get standing in front of an audience and doing something like this to dispel those myths, the media industry then gets another 100 goes. And so we've got to always be really, really on it and driving the point home. And so I think that's why it's really important. And it comes down again to literacy, media literacy and expectation, and learning to realize what's fake and what's real, and separate fiction from reality.
That's really interesting. And I wonder if I could turn to Dan and Eleanor and Roger too, as a surgeon. There's a question that's come up in the Q&A feed is really about a couple of things really that link to the idea of aesthetics. So aesthetics versus function, if you like. At what point, so I suppose from an artistic point of view and a surgical point of view, there's an idea of transformation. And that idea of transformation, surgically and artistically, leads back to this idea that that Tulsi raised initially about kind of invisible scars, and this sense that there is a self that can be saved, or there's an ideal of the self, or there's an ideal of the face that can be transformed, and attached to that, the sense of identity that can be regained as a result. And I wonder if you as surgeons or artists could speak to that. Or I suppose as a person that is undertaking that sort of transformation, where do you sit in that kind of aesthetic structure relationship?
Well, I think because I think I'll lead into sculpture and art, so Eleanor can follow on. But I think, first of all, the human condition is we've been obsessed by appearance. If we look at this critically with all of ancient civilization, all of the art history that we have available to us, there has been an obsession with manipulating visible difference, visible change for what we perceive for that particular time as being a norm or an aspiration. We live in an era now, a digital age, an age where information is available at our fingertips, where we have better understanding of the psychosocial makeup of the populations we live in, the immediate culture we're in, whereby it might be an opportunity to reset what we feel is normal and actually be more accepting and in factor into our educational aspects of our children that are young, of what difference, whether it be facial, whether it be musculoskeletal, whatever that difference is, that we're allowed to be different, it's okay. Adam alluded to it, and I think he's absolutely right. We have this constant battle. It's not only an imagery battle, but it's a professional battle in plastic and reconstructive and aesthetic surgery, whereby those that are highly trained, and training isn't just the didactic surgical aspect of it, it's the ethical implications, it's the link to psychology, to sociology, to the holistic well-being of patients, that we're in a constant battle against people who have done no formal qualifications, who are allowed to call themselves cosmetic or aesthetic surgeons. And they will ride the current wave of, the body change du jour for, what is ultimately a transactional or financial gain. We are always battling against that. And until we get higher level public health and governmental buy-in from that whilst that may be a small speck on the backside of public policy is actually really important, then, once we get that buy-in, we'll be very successful. And countries have done that successfully. Australia have done it. And other countries that we would put our healthcare system on parallel to have successfully achieved that. But what we determine as a norm, it really should be so variable that we're accepting. And there's more acceptance from those that feel normal to those that they perceive might be abnormal. And I think that needs a huge drive in education, really.
That's really interesting. Thank you. Do you have a view on that, Eleanor, as an artist?
Yeah, as a sculptor, I do feel for people who have been worried by the media into thinking they need to correct, people who are sort of in the big fat normal part of the bell curve that you talk about. People who feel that they need to spend a lot of money to correct something that is functionally of no problem to them, or something that is a sort of minuscule aesthetic variation, or that will something possibly even imaginary. And it worries me that there's an industry out there that's ready to separate them from their money to achieve that. If people could look at their own bodies and their own faces with a sculptor's eye, I think they'd be much kinder to themselves. Really, they would. And they'd see, the beauty in variation and curvature, and the character in what I call sort of facial event and cragginess, and the sort of individuality that possibly trying to reach for society's ideal of beauty, a kind of individuality that would be just ironed away into a sort of universal pretty blandness. So I feel quite lucky in a way. I think my profession and the sort of training I've had to do in order to be able to make things like that makes everybody look very beautiful to me.
And I thought it was very interesting the way you were describing that, Eleanor, first of all, when you were saying that the most difficult kind of sculpture to make is an 8-year-old with an unblemished face, sort of thing, and that you are actually attracted. I'm not sure if attracted is the right word, but you'll focus your attention on cragginess and individuality and these signs of people having lived a life and all the rest of it. And I think that often sort of goes in the opposite direction from what people feel they want to get more towards the where everybody else is, or towards some sort of ideal. And I think this idea of if everybody could look at themselves and other people with a sculptor's eye, they would see things differently. Because I think you kind of, well, I think everybody in the room, but we've been talking about accepting people as they actually are, rather than constantly wanting to turn into something different. And I wondered what you all thought about how we might do that, because I think, from surgeons and people with visible difference and sculptors, that we're all saying, in some ways, we're saying something rather similar, in that it's about valuing what people actually look like and accepting it.
Yeah, I love that idea of a sculptor's eye. I think particularly because all of the evidence is that the more cosmetic surgery people have, the more dissatisfied they are with their appearance. So there's no point at which they become satisfied. And I guess one of the questions that's come up again in the chat roll as well is around this idea about balancing that psychological desire for change when aesthetically there's nothing that someone needs to change, according to the surgeon's perspective, and balancing that sense of wanting to change. And what we know so far about face transplants is very little in terms of the psychological impact. But I wonder if any of you have thoughts, really, because surgery is essentially about making structural physical change. How do we possibly create an awareness of how that really feels, the kinds of psychological issues involved?
I think you need to educate people on what surgery actually is, if that makes sense. And I don't mean sort of like just the mechanics of it. Of course, we all know what that is. But I think very often, and I say this with all due respect to the two surgeons on the call, I think very often surgeons and surgery gets put on a pedestal, and surgeons get made as gods, and surgery gets almost like deus status. And it isn't the solution to all of life's problems. It can certainly help, granted, and I'm very grateful as someone who's had, 39 operations now. I'm very grateful for the skilled work that surgeons do. But I didn't go into an operation and come out of it a completely different person with a completely different skill set. I just looked a bit different. And you know, when I was a student, I went in broke, I came out broke. I just looked a bit different. And it's that old joke, do you have any questions about the operation? Yes. Can I play piano afterwards? Yes. Oh, great, I couldn't before. It's that old joke, isn't it? And it's medically, it's amazing, but it won't solve all the other litany of issues that people may have when seeking medical intervention. If you were insecure with kind of a slightly bigger nose or smaller boobs or a receding hairline, getting that fixed might not take away that feeling of insecurity. It's only a physical change. And I think we need to dig a bit deeper into our souls and the souls of others when we discuss surgery, and stop talking about it in a purely physical and transactional manner.
Yeah, I totally identify with that because, you know, growing up, first thing would be like, oh, are you going to get surgery to fix your scars? And growing up, I didn't realize I needed to fix them because I was in and out of surgery. You know, like Adam had lots of operations. I had skin graft, plastic surgery. So I literally thought that there's going to be this magic sheet that they're going to put this sort of new skin on and put it on my face and I'm going to look normal. But it doesn't work that way. So when I did ask my surgeon, I think they were really like, I don't know what you're trying to ask here, you know, because they didn't understand what I meant. They did say it's not like there's a magic wand and you're going to get this perfect skin. Your scars are your scars, you know, they will change over time as you grow, but there's not something that we can do to change it. So again, like kind of what Adam's saying, you got to dig deeper. And I think that's what I've done for myself, is to accept all the scars, you know, the whole patterns, the textures, the colors, accepted my nose as it is, or accepted my lips as they are. And yes, I've been very lucky to have laser surgery treatment to help the functionality of my skin and my scars, but not to change the appearance completely, because I don't want to look like anybody else anymore. I've taken a long time to accept what I do look like.
Can I raise a question that came out of that conversation that Tulsi and I had when Tulsi, you were saying, you know, it took you quite a long time to make that transition to accepting and being proud of you know, all the things you said about that change that you underwent. Dan, as a surgeon, I guess do you have to kind of gauge where somebody discussing plastic surgery, say with you, about where they might be, because you know, several people have talked about things that might not seem particularly might not seem a problem to you as a surgeon, but clearly are to a patient. How do you get that balance between not being paternalistic and not imposing your views on somebody, but on the other hand, not being meddlesome or not acting too soon when you think that somebody may be going through the kind of transition that Tulsi described? Because it's quite a difficult balance to strike, I imagine.
It is difficult. I think that we are one of the few specialties that are very heavily engaged with psychology services in the hospital. In fact, I have some colleagues who will only consult with a psychologist present for certain patient groups, which I think is almost pioneering in a sense. The issues that we have to gauge are, I think, a couple of fold. Does the patient have fears, or the person have fears of what may happen when it goes wrong? And gauging that and gauging reactions to when you describe what may go wrong, which is entirely plausible. We are completely finite and limited in our abilities. Every surgeon has complications. Every type of surgical procedure has fallibility, to what their reaction to that may be. For patients that we've touched upon within the spectrum of the discussion, where they may have minor issues and it may be a cosmetic alteration or a small alteration, what are their fears? And who are they looking to for acceptance of their difference, whatever the difference is, or whatever their improvement that they're seeking is? So if they are happy with the outcome, but their parents aren't happy, or their friends or their partner aren't happy, what will the impact on them be? What will the social and psychological impact on them be? And whilst we as surgeons are not at all trained psychologists, those are wishy-washy answers to those kind of probing questions, to me, immediately trigger the need for major psychological input, because it's highly likely that my efforts, which are completely limitable, they are not limitless in changing appearance, even if I felt it was appropriate, may not actually be what that person needs. That person needs some form of higher acceptance within their social circle or bubble, as we've become known now. We're all in bubbles. And I think that actually that takes far bigger precedence. And me as a clinician, it's taken time to build that maturity to gauge that. And there isn't an easy way to learn that. And so I think actually more and more, the type of work we do should include very close collaboration with psychologists, if not a very measured inclusion of psychologists in our work, because we may actually find that not only would our results improve because patients are psychologically prepared and we select patients better, but we don't psychologically damage people by some of the surgeries we do. I'm talking about the whole spectrum, from cosmetic or aesthetic surgery to appearance changing surgery for those that have what we perceive as differences.
Thank you, Dan. There's a couple of questions in that relate to, I think, what you're alluding to about this idea of time and how we change over time and our attitudes change over time. And of course, our faces change over time. One question that's come in with reference to Adam's work on eugenics, the documentary on eugenics, and it relates to actually what all of you have talked about, which is demystifying difference and creating a wider spectrum or an understanding of how diverse humans are. How do we actually affect change like that? And one of the questions that's come through is about how we educate children, how we effect this kind of change in wider society. I'd be interested in your thoughts. Dan, you have your hand up.
Yeah, I think actually education is so important. I've used this example before, that children at a very young age, I think I've told Faye this, I am just looking around, they're not listening in earshot. I have two children who have grandparents and parents of completely mixed ethnicity. However, one of my children identifies as a totally different skin type to the rest of the family. So there's four of us. So when they drew pictures as a 4- and 5-year-old, we'd have four stick people, and one of them would be colored brown because that child identified as having the same skin and appearance as one of their grandfathers, who is Middle Eastern and brown. And we can't underestimate how early people have body image perception. And so because they are thinking about it or have some form of understanding about people looking different, this probably goes back to before we had language, is that the face, its mimicry, its visibility, the body's visibility was probably one of our only ways of communicating. And so we should 100% tap into the ability of education to try and change that narrative of what we perceive as different. So people grow up in a much more accepting way. And then there's a whole bigger spectrum, and the curve, if you like, or the bell curve that Adam described is flattened into what is normal or what is perceived as normal. And so we certainly do that in our home, but I guess I have a unique situation in my line of work and interest of trying to impart that. But it really fundamentally, it's almost like a public health message. Well, it is. It's not almost, it is a public health message, and perhaps a public health initiative to drive that education, to allow us to normalize, particularly where the face is concerned. I think that we are all different. There are differences, and the differences that sometimes are the result of inherent genetic things that we can't change.
Right. I suppose just to bring the conversation back a little to the idea and the role of face transplants. I wondered whether it's quite interesting to me that when people think about face transplants, they do focus on the aesthetic and on how people look and whether their identity changes and those kinds of really complex ethical issues around whether we could or should do them. But of course, some of the issues around face transplants increasingly are about ballistic injuries where people have very damaged jaws. And so they have an inability to drink or to smile or to do any of the things that we associate with emotional expression. And I wondered if any of you had any thoughts about how we have public conversations about these nuances in face transplants against this backdrop of prejudice and concerns about appearance.
And this is going to sound rather simplistic. I just think we have them, and we keep having them, and slowly push back against the tide. And I think very often, because this is such a loaded topic against an equally loaded culture, we tend to overanalyze it and overcomplicate it. When if you then kind of take a step back, take a deep breath and boil it down to its component parts, you realize that it isn't actually that deep. And the best way to have these conversations is to just purposely design platforms to have these conversations. And once you have the message and the mechanism down pat, you just keep doing it and affecting positive change. But I don't think it's anywhere near. I think we make these things a lot deeper than they otherwise need to be sometimes.
That's interesting. I think one of the fantastic things about the AboutFace project is that we get to talk to a wide range of people. We get to speak to ethicists, psychologists, people who live with visible difference, surgeons, surgical teams, artists, and really have a variety of perspectives on what the face is and what the face does. Can I ask you whether you feel there are particular issues related to the face as an organ being transplanted, leaving aside the questions about immunosuppressants? What is it about the face, do you think, that creates this kind of cultural uncertainty?
I think the face is the organ of communication. Like most of the communication is done through the face. Of course, you've got things like kind of body language, posture, and what have you, but things like the communication triangle, eye contact, smiling, facial expression. If the function of your jaw, etc., is affected, it affects the ways in which you can use your voice, and you can say the exact same words but with different facial expressions, and get things like humor, sarcasm, wit, hostility, aggression, kind of down pat. And so, yeah, I think the face is, as I say, the organ of communication, and it's the first thing we see when we meet a person. So that's what we instantly jump to when we want to judge someone or figure them out. It comes down to unconscious bias, and I think, and it's not a bad thing to do. We all do it. It's how we're sort of not entirely hardwired, but almost hardwired. And it doesn't make us bad people for doing it, just products of our environment. And it's then what we do with those initial reactions and how quickly we can process them, and how quickly we can flatten that bell curve, at least in our own minds, if not for wider society, that will then have a direct impact on how easy these conversations become to have. And I think we're in a culture where people almost put difference and danger in the same category, in the same way that sometimes we get disability and inability confused. We get difference and danger confused, and we need to create an environment where those two things are much easier to separate than they currently are. I mean, I would happily put my hand on my heart and say I have a disfigurement or I have a visible difference, but I would never call myself like dangerous.
I was just thinking when you were talking, Adam, and going back to what Eleanor was saying, that there's something about the complexity and the subtlety. You know, when Eleanor was saying, you know, a tiny little change to the angle of some tiny part of the face makes all the difference to the emotional, to the emotion and the communication that we read from somebody's face. And I think there's something about that extraordinary sort of richness of expression and things that we become accustomed to reading in people's faces that we very often only notice when it isn't there for whatever reason. And I remember, you know, the first time when I used to encounter people when I was a medical student who had the kind of facial paralysis on one side of the face, or people who had had strokes or whatever, it used to strike me how very much it was difficult to come to terms with not having that extraordinary palette of expressiveness that most people that I encountered did have. And I just wonder if there's something about that, about, you know, the face being so rich and so subtle and so difficult to put into words, but so powerful to read, that these small changes or these big changes actually have a really powerful impact in how we perceive communication. And maybe we have to see beyond that and think beyond that in the ways that we've been talking about in this session. Maybe we have to make a deliberate effort not to allow that to get so much in the way.
Mm-hmm. So to come back with a question there, because I found something you said really interesting. That you said that the richness of the communication is something you don't notice till it's gone. And anyone feel free to chime in on this. Do you think that on some kind of level we take the human face and the 97% middle of the bell curve, do you think we take it for granted? Do you think it's something we just don't think about enough?
Well, personally, I think we absolutely take it for granted. I mean, I think we're so used to being with people all the time and to reading them and to responding to them and to using our own faces to respond to what we perceive in their faces and all the rest of it, that it's a kind of bit like breathing. You know, we're just not aware of it until for some reason it isn't working properly. And I don't know. I'd be interested in what other people think.
Eleanor.
Yeah, I've been sort of rolling it around in my head whilst listening to you talking already. And if I imagine myself as the recipient of a face transplant, and we're all just a serious accident or illness away from needing one, I think I would want it to work really, really well, because as soon as the movement of it is inadequate to the feelings you want to express, you have to find other ways to communicate. But more than that, and I may be about to go where angels fear to tread, but because I'm the art person, I'm allowed to address issues of imagination and myth and sort of atavistic suspicion, superstition and feeling. There is an ingrained sense in us that the dead don't come back. And if I had my facial transplant, I would be presenting the people I was talking to with the face of a dead person. And there would be something at the back of their minds going, no, that's wrong, it's wrong. Or just not morally wrong, but just it's against some strange law of nature. And there seems to be something about facial transplantation that goes into, and almost for all of our history, this would have been a mythical situation, and suddenly it's possible. Mm-hmm. I think this is what piques people's curiosity about it and what makes it such a touchy, sensitive area. It's this sense that we're actually breaking a taboo, but for a beautiful and glorious reason, to give somebody a new lease of life. and it's now possible to do it, and it's this new situation. Anyway, that's my topic with.
Yeah, that's really interesting. I think it connects to this ideas around surgical innovation that are really central to the question about face transplants. At what point does society think that a form of surgical innovation is okay? Because we have the same kind of debates, of course, around heart transplants. And the heart is another emotional organ that people imbued with all kinds of cultural meanings, and worried about carrying on the personality of the donor. So it's interesting, isn't it, that we're having those sort of questions revised in face transplant.
But you don't see it directly, do you?
No, but you hear it and you feel it.
The heart, yes, yeah.
Right.
Yeah, just to add to that, you may have all seen the memes and the things on social media whereby a heart transplant recipient has a family member of the recipient listen with a stethoscope to their chest. They feel a connection to that beating organ. So yeah, I agree with Faye in that. Although it's not visible, there is a tangible, connection to these things because we have a romanticized or a mythological, literary sort of connection to the heart because we feel, well, not unreasonably, that it really is the thing that makes life possible.
Yeah, I slightly resonate with that because I've got a kidney transplant. So, and mine, was with someone who'd passed away. And I really do feel, although obviously it's a part of me, I do feel like there's something foreign. I don't know anything about the recipient, as in I have to have a connection with the family, but there's definitely some emotion attached to it. Then I recognize that actually that's not mine. That must have belonged to the kidney. So it's a very surreal thing having a foreign sort of concept in my body. And I can imagine with the face, like you've got to look at it all the time. Like it's not something, my kidney is not something I see all the time. Yes, I see the scar, but the face is something so surreal. And when I talked to Roger about it, it's like the psychological impact of suddenly living with a whole new face. It's like almost like you've got a second chance to be another person again. But with that comes a lot of other complications as well, or psychological implications as well. And then if whoever's face that we've got and their family, there's a connection, do they then want to treat you as if it's that their son, daughter, grandmother, whatever it is? Where do we draw the line? How much contact we have there as well. It's quite open questions there.
I think so. And I'm conscious that we are running out of time now, and I need to let you all go and have a glass of wine. But I'm going to ask a challenging question of everybody that comes from a perspective of an emotion historian. And one of the things that's really interesting is language, and understanding language over time and how we put our feelings about these complex things into words. So I'm going to ask each of you, if you would, to sum up your feelings about face transplants in one emotion word, if you possibly can. Roger.
I think uncertain for me, because I think we've had all these ideas, all these sort of very I sort of move from one extreme to the other in how I think about it, and I really feel I just there are so many more questions than answers, and I think it's such an exciting area to think about, but there are so many scary things as well as exciting things, and so much that is not known that I think I really do feel that sense of uncertainty in a positive sense, in the sense of sort of being on the verge of a new area in all sorts of ways, but uncertain in that I just simply don't know how it's going to evolve.
Thank you. Dan.
Challenging for what I think are obvious reasons.
Thank you. Eleanor.
I think of it as I would think of a great adventure, something unknown, something new and possible and very exciting and adventurous. Yeah.
That's a nice one. Tulsi.
Innovative, I think, for me, kind of tying in between what Dan says and Roger. It's like yes, uncertainty and challenging, but on the other scale, innovative, like it's something new, and like Eleanor said, adventurous. So yeah, I like that, innovative.
Adam.
Fascinating. Much like this conversation has been fascinating, and the way we're all looking at it from our own different perspectives with a certain degree of almost fascination.
Yeah, wonderful, thank you. And I just wanted to bring in a note that was put in the question role. It seems that the heart of the prejudice, people with facial difference experience, is the phenomenon of othering, that it seems easier to fear something that they don't understand than to embrace it. And that takes us back to education and talking. The more we can share our unique experiences, the greater chance we have of connection. Thank you, Barry. So I think that's a nice note on which to end, actually. It's been absolutely fascinating to talk to all of you. Thank you, Roger, Tulsi, Dan, Eleanor, and Adam. And thank you to Sarah Hall for putting this event together, and to Steve Parker for his IT support. And thank you for being here and asking such fantastic questions. Please keep in touch about our events on our website, which is aboutfaceyork.com, where you'll find many resources about face transplants and links to the rest of our Being Human events. Now, in a few moments before you log off and start your weekend, you'll be asked to complete a simple 4-question survey from us at AboutFace, in addition to the Being Human survey that you'll receive by email tomorrow. Please let us know what you think, because it really helps us to think about the best ways to put together events like this, and to understand the kinds of questions around facial difference, facial transplantation that we really need to be asking. In the meantime, thank you very much.